I'm going to present to you a very brief systematic review on drug-associated hidradenitis suppurativa. It says drug-induced in the abstract, but I think it's more appropriate to label it as drug-associated. So again, no conflict of interest to declare today, and just briefly I'd like to run through, basically I'm going to describe to you the results of the systematic review about drugs reported to be associated with HS, and understand the critical evaluation of the relevance of those reports and whether indeed they are likely to be causative in terms of cases of HS, and the implications regarding the pathophysiology of HS in terms of the mechanism of action of these medications. So the main question was really, are there truly cases of drug-induced or drug-associated HS? There are multiple different causative factors which can contribute to the disease, as we know, and as lots of people have been speaking about today. But what cellular pathways are highlighted in the drugs that have been identified in terms of contributing to disease? So again, just very briefly, but I won't harp on about this, the main paradigm in terms of deficient Notch signalling in terms of being involved in HS, but we do know that there is interaction between Notch and other external pathways as well involved in many inflammatory cascades which have been identified in a few of the different talks that have occurred earlier on today as well, including the PI3K, AKT, the MAPK pathway, numerous other cell cycle pathways as well. And we do know that there are intracellular links as well as extracellular links between growth factors, IL-6 receptors, as well as the Notch receptor, which is kind of demonstrated here in these diagrams. And these main three pathways we know from some of the previous talks have also been implicated potentially in the role of cellular mechanisms in HS. And so, keeping all of that in mind, just briefly, the methodology we used for this systematic review was to identify a number of articles which have been reported in terms of causative HS. We found 13 articles, and these were critically evaluated using the Naranjo criteria, which was used to determine the probability of whether the drug identified was likely to cause the disease or not, and this was given an objective scoring with 3 objective scorers. And just briefly, these are the results which have shown that there are a lot of paradoxical reactions to adalimumab and infliximab, and then a whole lot of different drugs which have also been reported as implicated, including lithium, vemurafenib, cyclosporin, and tocilizumab, interestingly as well. Unfortunately, this was completed prior to the identification of the recent case reports of a lot of the gamma secretase inhibitors, which would have been really interesting to speak about as well. But I think the main thing that you should take away from this busy slide is that the range of incubation period between drug exposure and onset is extremely wide. And the score in terms of whether it is implicated is very, very low. So one has to have a very healthy dose of skepticism as to whether the drugs are actually implicated or not. And that was the main thing we took away from this as well, that it seems quite unlikely. And having a little look at the other natural history factors, which, limited by reporting bias, of course, 98% of cases actually had many other reasons which would much more likely explain the onset of HS, whether the presence of family history, the presence of metabolic syndrome and obesity, or other inflammatory disease which is known to be associated, such as Crohn's disease. So, look, in all honesty, we feel that it's quite unlikely that there are certain medications which can cause hidradenitis per se, but the question remains, does it eliminate any chance of drug-related contributions? And look, it's questionable. By examining the pathways that a lot of these drugs do interact with, there are a lot of commonalities, but these are common pathways as well. So, we have thought in the old paradigm of gamma secretase mutations causing Notch activation and then impacting on gene expression. However, a lot of these different pathways may well be involved through mechanisms that aren't clearly elucidated at the moment. So, could it be that some of these medications are shifting these cellular pathways down a pro-inflammatory route? Look, it may be, but the causation, is very different from association. But there are some tantalising hints that perhaps there may be some involvement. So what relevance does this have for practice? In terms of clinical practice, it seems very, very unlikely that true drug-induced or drug-associated HS does exist, but the minor contribution of some forms of pharmacotherapies may cause minor alterations to innate immunity. However, the clinical relevance of this is still highly contested. But the things that are known are the elevated estrogenic states, and particularly the ratio between estrogenic and progesterogenic states, as you do find postpartum in pregnant women with HS, and the contribution of metabolic comorbidities, which we already know about, and other potential drug exacerbants, so the rare cases of paradoxical activation with the use of TNF-alpha inhibitors and things like that. And I guess the main take-home point would be for people who see a lot of HS, for a lot of experienced clinicians, is that the adequate timeline and reporting of drug-induced cases is really paramount if we are going to untangle this in the future. Thank you.